So very often patients don't know whether they have a cold, an allergy, or a sinus infection. And these are hard to pull apart because sometimes cold can run into a sinus infection or an allergy can run into a sinus infection. So the difference really is when you have a cold, usually there's clear discharge, postnasal drip, you may be feeling run down, but usually that disappears in 5 to 7 days and then it's gone. That's a cold. If you have an allergy, those things can crop up in the spring, in the fall, when you're around something that you're allergic to, or it can be all year long, like people that are allergic to dust. And in those patients, they'll get some itching, runny eyes, runny nose. They won't get fever the way they may get with a cold, but sometimes these are hard to decipher. But if you're getting it all year long, or you're getting it for a solid season and there's no yellow or green discharge, which is what you would have with a sinus infection, then most likely it's an allergy. Sinus infections, those are something that are more resistant to getting better on their own. Sinus infections linger definitely more than a week. Sometimes patients come in and say that they're sick all year long, but then they get flare-ups 2 or 3 times. And those flare-ups should be warnings that they need to get in to see a doctor that can understand the difference between a cold, an allergy, and chronic sinusitis, because patients may have all 3 at different times during the year. When you have chronic sinusitis, what do you suffer from? You can suffer from postnasal drip, congestion, coughing, hoarseness, headaches in your forehead and your cheeks. You may feel run down, your ears may feel clogged. You may have indigestion, heartburn. You can have fever, low grade usually, yellow and green discharge that you blow out of your nose, cough, you're coughing up this yellow and green discharge. So for patients that have any of those symptoms, or for patients that have any of these symptoms, if they're recurring, they really should get in to see an ear, nose, and throat surgeon that is very equipped to making a proper diagnosis of sinus problems versus allergies versus a cold, and apply the appropriate treatment.